Hello? Anybody here?
Men of goodwill and generosity should be able to unite regardless of party or politics.
5, 4, 3, 2, 1.
You ready? Here we go.
Hey, it's Ted. Man, I bumped my little table. That was terrible. I shouldn't have done that. I'm so sorry about that. Shaking you up gonna make you dizzy. Are you dizzy yet? Sitting on the front porch, living down the expectations of member of the 47% of mobile home dialogues on video. Isn't that cool? It's cool. I got a couple more things to say about health care, and then I'm just gonna let it go. Because it's just getting done to my skin. I'm gonna move on to something else, okay? Is that alright with you? I hope so. My wife says I look stupid. Do I? Send me an email. Tell me if I look stupid. You know, leave a little thing down there. Say, man, you do look stupid. Why don't you quit doing that? I won't, but you don't have to watch them. Yeah. Anyway, I was talking about doctors who are bitching and want to quit because they're not making enough money, or not making enough money. Man, and they have all that paperwork to do. You know what? I'll bet you a nickel to a hole in a donut them doctors ain't doing that paperwork. You know what they're doing? They're picking up that phone and they're calling that agency and they're saying, send me over somebody that can do paperwork. And they're putting the phone down. And about 2 hours later, this cute young woman comes walking in there, or this middle-aged housekeeper, or whatever, 99% of the time it's a woman. Is that sexist? And they come in there and they say, the agency sent me over here and I am here to work. So they bring that person in there and they say, how much do you type? She says, I'm 675,000 words a minute. I'm the best typist you'll ever see in the whole world. And they go, cool. And they lay these things down here and they say, we need you to transcribe this and we need you to fill this out according to these standards and blah, 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 blah. And that's what she does. And that doctor walks by and sees that person, don't know who the fuck she is or what she's doing because he don't run that office. And he goes and he says, well, I'm going to the golf game and, I'll be back in an hour and a half. Just make them poor shits out there in my waiting room sit and wait. Okay? I'll try to be back if I don't get rained out, And all those patients sitting out there in the waiting room, sitting there seeing him going out the back door with his golf bags, just going, I hope this little electrical storm, the son of a bitch, hit shot. Oh, that'd be ugly, wouldn't it? Then they wouldn't see the doctor for sure. There's this little problem between the general public and them doctors these days in there. That's what happened. I know about, these services because my wife works for one. And they don't pay them people shit. They didn't pay them people, 8, 9, 10, 11 bucks an hour or something like that. Don't pay them anything. And that doctor don't have to worry about a damn thing about paperwork. Even his office manager who's doing all that shit, all he does is cut one little check. He don't have to worry about any of the other stuff goes along because that service provides all that. I know about that stuff, buddy. Yes, I do. And that's what it is. Now, here's the deal. Doctors bitching about that. But let me tell you something. Doctors shouldn't be bitching. Do you know what the average salaries are of doctors? I looked this up on payscale.com. This is the average, the median, the numbers in the middle. A general practitioner, family doctor, $145,805 a year. A doctor of internal medicine, $150,000. ER doctor, $92,000. Just sometimes GP, it's got what's got on their family doctor. It's got 104 or 5 down. It's got general practice 120. That sucks, you know, like $30,000 difference. That's terrible. And a gynecologist, $181,000, and an oncologist, $197,000. Man, I'd hate to have to live on that. I'd just fucking starve to death. You know what I mean? It takes my wife 4 years to earn that much. But they want to quit. They're not making enough. Yeah. That's bullshit, people. One last little thing. Bunch of them are goddamn crooks. Nah, let me take that back. Some of them are crooks. And they're bitching about the paperwork, and here's why there's so much paperwork, because there's so much fraud. I looked this up. There's an article on Forbes last May. It said how much Medicare and Medicaid fraud is out there. It says no one really knows for sure. In 2010, the Government Accountability Office released a report claiming to have identified $48 billion in what it termed improper payments. 10% of the $500,000 billion of that year went to fraud. I mean, that article said the mafia is getting into that. So there's so much fraud. You got to have paperwork. Put the fucking thing on a computer, and you can keep up with it. Quit bitching about it. Take the money you have and be happy, and give a damn about your patients. How about that? You know, doctors are supposed to care. Do you care, Mr. Doctor? I don't have a hell of a high opinion of doctors. Been to a bunch of them. Don't know their ass from a hole in the ground. And they look at me like I'm an idiot because I can learn and I can understand medical terms and I can see through their bullshit. Just because I look like a redneck sitting on the front porch in front of a mobile home with a dirt drive and an old van does not mean I'm an idiot, Doc. Okay. That's enough healthcare shit for today. Don't you think I've already, beat that horse today? I hope you have a good day. Check out the rest of my videos on this video blog. And take care of yourself. Here.